Cognitive disorders. Cognitive disorders are a group of mental health conditions that affect a person's ability to think, remember, and concentrate. These disorders can make it difficult to perform everyday activities and can interfere with work, school, and personal relationships. There are many different types of cognitive disorders, including ALZHEIMER'S disease, PARKINSON'S disease, HUNTINGTON'S disease, and attention deficit hyperactivity disorder, or ADHD. Cognitive disorders can be caused by a variety of factors, including head injuries, stroke, tumors, infections, and degenerative diseases. Some cognitive disorders are also hereditary. Cognitive disorders can be treated with medication, psychotherapy, and other therapies. In some cases, cognitive disorders can be cured. In this video, we will discuss cognitive disorders in more detail. We will also cover the causes, symptoms, diagnosis, and treatment of these conditions. So watch till the end, and if you haven't liked the video yet, be sure to like it and subscribe to our channel so you don't miss any other videos. The most common cognitive disorders are: Number 1. ALZHEIMER'S disease. ALZHEIMER'S disease is a common cognitive disorder that affects millions of people worldwide. It is a degenerative disorder that causes memory loss, impaired thinking, and changes in mood and behavior. Alzheimer's is the most common form of dementia, and it is incurable. Early onset Alzheimer's disease is a rare form of disorder that affects people under the age of 65. Early onset Alzheimer's is often more severe than Alzheimer's, which develops in later life. There is no known cause of Alzheimer's disease, but it is believed to be caused by a combination of genetic, environmental, and lifestyle factors. Also, there's no known cure for Alzheimer's disease, but there are treatments that can slow the progression of the disease and improve the quality of life for those who have it. Number 2. Vascular dementia. Vascular dementia is a common type of cognitive disorder. It occurs when blood flow to the brain is reduced, causing damage to brain tissue. This can lead to problems with memory, thinking, and decision-making. Vascular dementia is often caused by strokes or other problems with blood vessels. If you have risk factors for stroke, such as high blood pressure or diabetes, you may be at increased risk for vascular dementia. There is no cure for vascular dementia, but treatments are available to help manage symptoms and slow the progression of the disease. If you think you or someone you know may have vascular dementia, it's important to see a doctor for a diagnosis. Number 3. Lewy body dementia. Lewy body dementia, or LBD, is a common cognitive disorder that affects older adults. LBD is characterized by problems with thinking, memory, and movement. People with LBD often have difficulty remembering things, making decisions, and controlling their body movements. LBD is a progressive disorder, which means it gets worse over time. As the disease progresses, people with Lewy body dementia may experience hallucinations, delusions, and difficulty moving. There is no cure for LBD, but there are treatments that can help manage the symptoms. If you or someone you know has LBD, it is important to seek professional help. LBD is a serious condition, but with proper treatment, people with LBD can live relatively normal lives. Number 4. Parkinson's disease. Parkinson's disease, or PD, is a common neurodegenerative disorder that affects 1-2% of the population over the age of 60 years. The cause of PD is unknown, but it is thought to be due to a combination of genetic and environmental factors. Symptoms of PD include tremors, rigidity, slowness of movement, and impaired balance. PD can also lead to cognitive problems such as dementia. There's no cure for PD, but there are treatments that can help improve symptoms. If you or someone you know has PD, it is important to seek medical help. There are many resources available to help people with PD and their loved ones cope with this condition. Number 5. Huntington's disease. Huntington's disease is a common cognitive disorder that affects millions of people worldwide. The disorder is caused by a mutation in a single gene, which leads to the deterioration of nerve cells in the brain. This can lead to a wide range of symptoms, including cognitive impairment, movement problems, and psychiatric issues. There is currently no cure for Huntington's disease, but there are treatments available that can help to improve symptoms and quality of life. If you or someone you know has Huntington's disease, there are many resources available to help you cope with the condition. Number 6. Normal pressure hydrocephalus. Normal pressure hydrocephalus, or NPH, is a common cognitive disorder that affects older adults. NPH is caused by a buildup of cerebrospinal fluid, or CSF, in the brain, which leads to the enlargement of ventricles. This can cause a decrease in brain tissue, resulting in cognitive impairment. NPH is often misdiagnosed as Alzheimer's disease or another form of dementia, as the symptoms can be very similar. However, NPH is a treatable condition, and with the proper medical intervention, patients can improve their cognitive function. Treatment for NPH typically involves a shunt surgery to relieve the pressure on the brain by diverting the excess CSF. With treatment, people with NPH can often improve their cognitive abilities and regain their independence. If you or a loved one is experiencing cognitive decline, it is important to seek medical help. An accurate diagnosis is crucial to receive the proper treatment. Number 7. Traumatic brain injury. Traumatic brain injury, or TBI, is a type of cognitive disorder that can occur after a person suffers a traumatic event. It can lead to several impairments, including memory problems, language difficulties, and executive function deficits. TBI can occur after a blow to the head or a penetration injury and can range from mild to severe. Symptoms of TBI can appear immediately after the injury or may not appear until days or weeks later. If you or someone you know has suffered a TBI, it is important to seek professional help as soon as possible to ensure the best possible outcome. There are several effective treatments available that can help improve cognitive function and quality of life. Number 8. Stroke. A stroke occurs when the blood supply to the brain is interrupted, causing brain cells to die. This can lead to several cognitive problems, including problems with memory, attention, and language. Stroke is a common cognitive disorder, affecting about 1 in every 20 adults over the age of 50. However, it can occur at any age, and the risk of stroke increases with age. Stroke is also more common in people with certain medical conditions, such as high blood pressure, heart disease, and diabetes. If you or someone you know has had a stroke, it is important to seek medical help immediately. There are treatments available that can help to lessen the severity of cognitive problems. With early treatment and rehabilitation, many people can make a good recovery from a stroke. Number 9. Epilepsy. Epilepsy is a neurological disorder that affects the brain. It is one of the most common cognitive disorders, and it can cause seizures. Seizures are a symptom of epilepsy, and they can range from mild to severe. Epilepsy can also cause other symptoms such as changes in mood, sleep problems, and problems with thinking and memory. Epilepsy is a condition that can be managed, but it is important to seek medical help if you or someone you know has seizures. Seizures can be dangerous, and they can lead to other health problems. Epilepsy is treatable, and there are many resources available to help people with epilepsy live healthy and fulfilling lives. Number 10. Attention deficit disorder. Attention deficit disorder, or ADD, is a common cognitive disorder that affects both children and adults. ADD is characterized by difficulty sustaining attention, impulsivity, and other hyperactivity. While the exact cause of ADD is unknown, it is believed to be caused by a combination of genetic and environmental factors. ADD can often be successfully treated with a combination of medication and behavioral therapy. If you or someone you know has symptoms of ADD, please talk to a doctor or a mental health professional. With proper treatment, people with ADD can often lead successful and productive lives. Number 11. Mild cognitive impairment. Mild cognitive impairment, or MCI, is a common cognitive disorder. It is characterized by a decline in cognitive function, but not to the extent that it interferes with daily life. MCI can be a precursor to Alzheimer's disease and other forms of dementia, but not all people with MCI will develop dementia. MCI can affect people of all ages, but it is more common in older adults. Symptoms of MCI may include memory problems, difficulty with executive function, such as planning and decision-making, and language problems. MCI is often diagnosed after a person has a cognitive decline that is noticed by family and friends. If you or someone you know has been diagnosed with MCI, several things can be done to manage the condition. These include engaging in mentally stimulating activities, staying physically active, and following a healthy diet. Engaging in mentally stimulating activities can help to delay the onset of dementia and can also help to improve cognitive function in people who already have been diagnosed with dementia. Several activities can be beneficial, including puzzles, crosswords, and brain games. Staying physically active is also important for people with MCI. Exercise can help to improve cognitive function and delay the onset of dementia. It is also important to stay physically active to reduce the risk of developing other heart conditions, such as heart disease, stroke, and diabetes. Being physically active also helps to improve mental health and overall quality of life. Number 12. Frontotemporal dementia. Frontotemporal dementia, or FTD, is a common cognitive disorder that affects people over the age of 60. The disorder is characterized by changes in behavior, personality, and language. People with FTD may become more impulsive, withdrawn, and disinterested in hobbies and activities they once enjoyed. They may also have difficulty understanding spoken or written language. FTD is the most common form of dementia in people under the age of 60, and it is currently the second most common form of dementia overall. The disorder typically affects men more than women, and it is most common in people of European descent. There is no cure for FTD, but treatments are available to help manage the symptoms. These treatments can include medications, therapies, and support groups. Cognitive disorders refer to a wide range of conditions that affect cognitive development or performance. These disorders can have a significant impact on a person's quality of life and can be difficult to diagnose and treat. Early intervention is often critical to ensuring the best possible outcome. If you enjoyed the video, be sure to like and subscribe to our channel so you don't miss any future videos. And what do you think about these disorders? If you or someone experienced any of these disorders, please let us know in the comment section below. Thanks for watching.